As a newly graduate registered nurse working in a very busy hospital, I will have to engage in different types of workforce advocacy that that can bring about changes in the environment that I work in. One such type of advocacy is self-advocacy, where I can advocate for myself. As a newly graduate nurse working in a busy ward, I'm aware that I will have to engage in situations that I'm unfamiliar with, or the procedures that I'm not confident of. This can include giving a medication which I'm not familiar of, or performing a technique or a procedure that I have very little experience of. In this situation, I can advocate for myself by for asking for help to a really experienced registered nurse or a nurse educator to help brush up my knowledge and skills and supervise my work so that I can provide safe and effective care for the patients that I care for. Another type of self-advocacy is that I can advocate for is about skill mixing. If I feel like the ward is understaffed, or if I feel like the skill mixing is about to put the patients at risk because there is a lack of knowledge and experience of the nurses, I can escalate this issue to the management so that they can take enough actions about this. Another type of workforce advocacy that I can do as a newly graduate registered nurse is patient advocacy. I believe that in a hospital or in any other healthcare sector, patient comes first, and it is very crucial to advocate for these patients. For example, if I'm working in a very busy ward, I can advocate for the patients to ensure their comfort and protection. For instance, if I'm working in a very busy ward and if a patient needs to have their needs fulfilled, I can talk with the other team members or the management, and we can discuss the actions that we can take in order to achieve the patient's needs. In addition to this, I can also, if I'm looking after a vulnerable patient, and if they're unfamiliar of their the treatment they're going through, and if they're uncomfortable about that, and if they have any doubts about that, and if they have to take any decisions regarding their treatments, I can educate them with my knowledge and the resources that are available in the hospital, or even I can ask the other members of the team or other staff members to help me support this patient so that I can provide safe and holistic care. Thank you.